Over the last 24 hours, we had one new case. Currently, we have 47 active cases across the country, and we have two persons right now in the hospital with COVID-19. With active cases, we currently have one case in Regions 2. We have 2 cases in Regions 3, 25 cases in Regions 4, 1 in Region 5, 10 in Region 6, 5 cases in Region 7, and 1 each in Regions 8, 9, and 10. We haven't seen a major increase in cases. In fact, for this year, 2022, so far we have recorded for the year 31,329 cases of COVID-19. In January, we had our highest amount of cases, where we had 19,900 cases. By February, that came down to 2,570 cases, and March it was 379, April 267. In May, we start seeing an increase. It went up back to 1,686 cases. Then in June, we got 2,715 cases, and then it started dropping again. So we saw in July 2,456 cases. In August, that went down to 1,032 cases. In September, we saw 287 cases. Well, there are still people who are infected with COVID, and while we have been tracking 47 cases, this is probably an underestimation, because there are lots of people who might have flu-like symptoms, which are now the typical symptoms that one would get when you get COVID, and they might mistake those symptoms for flu when it's COVID, so they can easily infect other people. So the idea is, if you want to remain safe, you should wear a mask, especially if you're in a crowded area, and in indoor environments you should wear a mask. So vaccination, on average, we do maybe about 200, 250 vaccines per day. And we currently have Sinopharm vaccines that are available. We have Pfizer, we have Moderna, and we have a very limited amount of J&J. So these are the typical vaccines that we use.